Hi, this is Paul Wakolbinger again with my fourth part series on the distal bicep tendon repair surgery. This is be my last of the series. I am now 6 months post surgery and about 3.5 months post clearing of normal activity from my surgeon. As I had mentioned in my prior videos, I am 53 years old. And the reason that I did these videos is because most people that I saw online that went through what I went through were either bodybuilders or they were in their mid to late 20s. So I thought it would be important to give people an experience for somebody that's around 50 years old or so. This injury is fairly common as people get older. As my surgeon had said to me, that many people, when they get later in life in their 50s, 60s, late 40s, they'll actually rip muscles off the bone where it is attached to the bone versus rip it in between or fray it like most of us did in our 20s during various sporting events. So pretty common injury. The surgery is fairly basic, as I stated before, in that it was only about a 45-minute surgery, and it really just became a waiting game. So you wait 13 weeks, and you're in a various brace, as you can see in my prior videos. Once I was cleared, my surgeon said, do whatever it is that you want to do. So there was no physical therapy. There was no stay away from heavy lifting. It was, if you want to golf, golf. If you want to lift weights, lift weights. So once I was cleared, I actually had no issues whatsoever. Immediately picked up a golf club, played golf. No pain, no restriction, no stiffness. I will say, after surgery, for the first several weeks, maybe a month, there was some numbness in the arm that was intermittent, so it would come and go. But in terms of numbness, on a scale from 1 to 10, it was probably a 3. So I could feel that there was, a bit of numbness down the outer part of my forearm, excuse me. But it really wasn't that annoying. I just had felt it. In terms of lifting and strength, it did take maybe 6 weeks or so to get close to 100%. I would say I'm probably in that 95% range. I could be at 100% or as good as I'm going to get. I really don't know yet. It has been just 6 months. So in terms of surgeries, if you've experienced any knee reconstruction or fused discs in your neck or back like I have had, this was a fairly easy surgery nonetheless. While it is unfortunate that you have to go through this, and I went through it, the pain, obviously, when you did the injury was very acute. Post-surgery for about 2 to 3 days I was on painkillers, but then quickly went off of them. And then it just really became a waiting game so as not to undo any of the work that the surgeon did. So again, once I was cleared, it was complete normal activities. I am 6 months post-injury, 3.5 months or 3 months post being cleared to do normal activity. As you can see, it's this bicep that I tore. It's pretty close, I would say. I'm not sure if it's going to get any better. From a strength perspective, when I'm doing curls, it is literally the same weight that I use with the right arm. There is some slight pain, a little bit of small sharpness of pain when I am doing curls, right? So I'm doing 35 pounds in direct tension right on that bicep. On a scale, again, from 1 to 10, it's probably a 3, right? So I feel it. I don't know if that'll ever go away. Whenever you have any sort of major injury, there'll always be some sort of lingering effect of some sort. So hopefully this was helpful. Again, 53 years old. I did this because most people were in their 20s, and I wish you all the best of luck with this. It really just becomes a waiting game. You'll be in pain 3 days after surgery, and then you just wait. and then you'll be just good to go with really no restrictions whatsoever. At least that was my experience. So hope this helps, and all the best.